Hello, everyone. I'm Kristen Willard with GAAPP, the Global Allergy and Airways Patient Platform. No matter where you live in the world, if you're a patient advocate, your voice has the power to affect change. But turning your experience into something that speaks to decision makers, people like policymakers or healthcare leaders, that can be really challenging and sometimes overwhelming. That's where the Asthma Care Map can help. The Asthma Care Map is a global advocacy tool that highlights common challenges across a person's journey with asthma, from diagnosis to treatment to long-term management. It was co-developed by GAAPP, the Asthma and Allergy Foundation of America, the Federation of Allergy and Airways Diseases Patients Associations, Euphoria, and Smile Smile. We also thank Sanofi for supporting this work and convening these important patient advocacy organizations. Asthma is a common disease. Most people have heard of it, and actually that's part of the problem. What many people may not know is that the majority of deaths are preventable. They may not know that there are subtypes of asthma, yet for the most part, these are all treated the same. They may not know that while it isn't typically done, it's possible actually to identify high-risk asthma, similar to how a doctor can categorize cardiac or heart risk. An additional important aspect is that when people think of the dangers of asthma, they think primarily of attacks. But constant, uncontrolled symptoms can be dangerous and fatal. More people need to know the facts about asthma and what can be done to affect change for those impacted. So let me tell you a little bit about the background for the Asthma Care Map. Across countries and healthcare systems, many of the same challenges exist. These can include delayed or missed diagnoses, limited access to helpful treatments, or even a one-size-fits-all approach to treatment plans. Poor disease control, and a lack of awareness and urgency about the true impact that asthma has on people and families who are affected. As advocates, I know you likely see these issues every day, but decision makers may not. They need clear, structured data and shared patient experiences that highlight what gaps exist in asthma care, why these gaps matter, and how they impact you and your communities, and finally, what really needs to change. This tool helps you tell this story. The Asthma Care Map organizes the patient journey into stages and highlights where gaps commonly occur. It helps you to identify priority issues you want to discuss, communicate how those issues affect people with asthma and their families, and frame them in a way that's relevant for decision makers. It turns your lived experience into structured, actionable advocacy. Let's talk about how you can use the Asthma Care Map in practice. You can use it to prepare for meetings with policymakers or healthcare leaders, support advocacy campaigns or awareness efforts, strengthen written submissions or public comments, and guide discussions within your community. How do you use it? Simply head to asthmacaremap.com and read through the landing page. As you scroll, you'll see more about the global burden of asthma and universal gaps in care. When you're ready, you can either create or customize your own Asthma Care Map or download a ready-made PDF. The ready-made PDF includes all the care stages, such as diagnosis and treatment, and uses global data to communicate care gaps and opportunities for change. The customized map allows you to choose the care stages you want to include, represent your own experience, and use data from your local community to speak to your decision makers. So head to asthmacaremap.com today to create your own map. Let's help your voices to be heard and drive change to improve the lives of all impacted by asthma.